Hi everyone, and welcome to the second episode of TAMCAST, the Healthcare Matters in Canada. So this is a podcast where we are talking about healthcare in Canada, and today we are going to explore the topic of home care services with our two guests, Jessica and Audrey. And I would like you to introduce yourself, please. Audrey, first.
So my name is Audrey DeVoest. I have been working as a PSW in the area of home care and also in a palliative care situation. So everything from personal care to dealing with families and
everything.
Everything. Jess.
I'm Jess.
Yeah, Jess.
I'm the owner of TAMCARE Home Health, and I have a background in nursing and technology and building businesses. So we are providing every service out in the community to advocate for clients and empower them and keep them at home and out of hospitals.
So home care, it's a very interesting market. It's booming because of the need of having patients going back home instead of staying at the hospitals, where obviously there is a shortage of bed and medical professional. What is your insight on home care services right now in Canada in terms of need, in terms of requirement, in terms of development and in the future?
I can touch on that one to start. So I think the need is huge right now. There's so many people that need care that are on wait lists for long-term care facilities, and they have been waiting for a long time. There's also the people that don't want to go to long-term care, that want to stay in their home for as long as possible and are having good caregivers take care of them in their home, but the caregivers are becoming burnt out and worn out. And even navigating the healthcare system is very difficult these days with all the different silos that are inside. So I think home care is a very much needed, and it's going to grow even more after the baby boomers start needing more care.
So Audrey, you have a big experience in healthcare. You've been working several years. Have you seen this trend of patients moving from the hospital settings to their home, and how do you explain that?
Yeah, for sure. And I feel a little bit like there's also a disconnect between the different services. So you have people that should be going into long-term care that aren't because, as Jess said, they can't get there. There's a long waiting list. You have people that are in the hospital needs the bed, so they're trying to move them to another place. They want to be at home, or some people want to be at home, but they don't have the healthcare workers that are available to look after them. So, they may get set up with an agency to have care, but then 3 hours before the shift is starting, they're getting a phone call to say that person's not coming. So people are, I think, in the wrong place often. So they should be in the hospital for a period of time. They should go home, but they can't go home because there's nobody to look after them. They maybe need to go to a hospice, but they haven't quite fallen below what we would consider the threshold maybe. So they come too early rather than too late. It's very disconnected, I find.
And would you say that, there could be concern that you will not get the same treatment at the hospital than you will get at home, actually? But do you have an experience on home care actually providing the same level of services, if not better than the one provided at the hospital?
Definitely. And the hospital is doing what they can, but every health industry right now is burdened with short-staffed. They don't have experienced nurses or PSWs. They're COVID brought schooling and graduations down, so everything piled up, so they're short-staffed. So they're doing what they can, but definitely what we find when people come home with our home care services, they actually get better. So they do see an increase. Some that have even been termed palliative, but now are not deemed palliative anymore because they've gotten so much better. Because we look at the whole picture also. I mean, the hospital tries, but they can't. But we look at the nutrition, we look at the fluid intake, we look at the output. We make sure that they're getting the psychosocial aspects, whether it be a massage, their pedicures, manicures, that kind of thing. So that really looks at that whole being and embodiment as opposed to just the physical needs.
Yeah, so home care could be a very good alternative to hospital for certain conditions, for sure.
For sure.
How the family or how someone will will select a home care services company for himself or for herself or for their family, what would be the criteria to select the right home care family for themselves?
Yeah, I mean, there is the aspect of having a stable availability. So to know that if you're going to select a company, that they are going to provide the services when they say they're going to, and not promise that they are, but then are unable because of staffing situations. I think I've seen that happen in my experience. Also the quality of care that somebody is getting, it's important. The family has to feel confident that the service that they're getting is the best for their mom or dad. Like, I would want my person to be looked after in a way that was safe and secure and the best possible care.
Yes. Jess, can you tell us if there are some red flags when looking for home care services? Like, there is a certain process that the company or home care services should follow, like with the care plan and the scheduling and the list of services that needs to be provided. But do you see any kind of red flag for the clients when selecting a home care services company?
That's a really good question. What I've learned is actually checking out their Google reviews is good to see what people are saying about them. We've noticed that word of mouth and referrals are the best way to get to grow the business, and that only stems from providing, the best care and providing the best outcome. So if the Google reviews are not good, then I would definitely not go with that company. Also, as Audrey said, is about the commitments, like seeing that they're showing up on time, even if you do hire them. But if you're seeing early on a change in multiple caregivers that they said that they could commit to coming in with routine caregivers, then that would be a red flag to me, because that doesn't get any better if it's already bad at the beginning. I can't really think of anything else. Could you?
The other thing that an experience that I lived with a family member was that that they're involved with the family. So if you're getting care in the home, that they're not just coming in and doing a job, that they're coming in and just figuring out, the family dynamics and what's happening and how they like to have care. Whether you come in early, do they want to have care at 7 a.m. or do you want to wait till they're awake at 8 o'clock? Certain things like their habits and the way that they like to do things. I always say to myself that I have to read the room, that I have to understand what the family's like. If they live in a very monochrome home, they want things kind of quiet, or they could have it a home that's very busy. They have other children in the home. There's a lot of noise. They're used to that. Then you can approach things differently. So I think understanding the family dynamics and reading the type of care is so important for staff.
That's brilliant, yeah. And I guess going back to a topic that very close to me is the technology and how the technology could play a role in the home care services, right? I think one of the selection criteria could be also that the home care services are using the technology, because nowadays the technology can do so much. Do you have any insight on the technology and how the technology can improve or can be used to deliver better home care services?
Mm-hmm. What I think is so important is to be able to relay efficiently information to the caregivers and the family members. So a technology system that would do that would be beneficial, because they need to be informed and they're in their busy lives, and most of the caregivers are becoming burnt out because of the repetition of health information or the having to communicate this to all their family members if they're the lead caregiver. So something that could update people very efficiently would be beneficial.
You have an insight on technology, and how did you see the technology being used in healthcare to improve the patient's condition?
Yeah, I mean, what Jess said, there is a lot of repetition. Again, I had that with a family member where we were just like giving information over and over, short of creating a group chat or something like that and communicating that way. That's obviously the simplest form, but to have it in a central place is very important, I think.
And as you said, involving the family and making sure the family is has the communication with the caregiver team, and the communication is all about exchanging information about the patient is key as well, right?
Yeah.
I think also like medical device monitoring, that kind of thing, home health monitoring, because what we're really focused on is seeing the crisis before it happens, like making sure that they're, not going to dehydration by understanding how much they've drank and communicating that to the other staff members, or when they need to take their medication, or vital sign tracking. We do a lot of vital sign tracking to make sure that their blood pressures, they're not getting orthostatic hypotension and they're going to be at risk for a fall. So that type of monitoring through technology is very valuable.
Another aspect is the financing of those home care services. How do you finance, how the family of someone could actually afford, to pay for those home care services that are needed? And are they expensive? I mean, some people, they have no idea that they could actually go get those home care services, and how much they will cost actually. So do you have any insight on the financing aspect of home care services and how this works in Canada?
Yeah, and also, so this was a situation with a family member. I was able to take time off of work and to be paid a certain percentage, like unemployment. And sometimes people don't know those things are available to them. So that's something, that can be communicated.
There's a caregiver tax credits too. We work with some companies that give information about when you are disabled, what advantages you can if you are paying out of pocket. So you either pay for services privately through your own, monies that you have available, or you are qualified under home care community support in Ontario that you have the ability to receive a certain amount of care based on your care needs from the government. And that's when another agency, what we do is we complement those agencies through private pay. So we'll layer on top of that and we'll become a part of their entire care team to provide services.
So you're trying to make it easy or easier for the people to get access to the home care services by actually advising them how to get the funds, and basically you're providing helps to them to find the money where it is, from the government or from some companies. Okay. Well, thank you so much for sharing your insights. I think it was very useful, and I hope to see you again soon for the next episode of TAMCAST.
Thanks. Was that so bad?
No. It was fun.
See what you guys can do with it.
Thank you.